what are the qualities that make a good medical student? There's so many to choose from, and no one has this cookie cutter idea of what a medical student should be, because no one doctor is the same. I suppose important things are obviously having, academic prowess, or at least passion for what you do for the medical sciences, and having a decent enough background in those basic sciences like chemistry, biology, physics, even maths. But more than that, I think the key to studying medicine is to have a passion for it, because medicine is not, as most people think, any more difficult than any other subject. No one piece of medicine is difficult to comprehend. The difficulty lies in the volume of work that you have to go through. So yeah, there's a ton of classes, a lot of contact hours, a lot of time spent in clinics, a lot of book reading that you'll have to do on your own. And if you don't have the passion or the drive for what you're studying, then what's the point? You'll be drowned by all the words in the text, and you won't find any enjoyment out of it. So while you need this whole set of skills to be a competent doctor and a medical student, including communication and empathy, teamwork and leadership, if you want just one thing at all, my biggest advice would be to develop your passion for what you're studying. Always try and find the interesting part of it. Not all of medicine will interest you. Just think that when you're reading through those boring chapters, that the reward will be to one day specialize in something exclusively that brings you happiness and interest.
Definitely, I would say is perseverance. I wouldn't because it's very important to not get so put off or bogged down, because there are times where you will feel like this is too much, I can't do this, and it's just overwhelming. And the way that you're able to keep going with it, even when you know that it's very tricky, is a skill that I think is quite underestimated, and is something that you really do need in a medicine course, especially during revision time and exam periods and things.
The medicine course at UCL is quite demanding of your time. I think it needs someone that's very organised, someone that enjoys their work, but it's also quite a social course. I think there's a lot of group work that we do together, especially in the clinical years. Often you're put in placement with people that you haven't really met yet, and so I think it would suit someone that likes getting to know other people and likes chatting to people.
I think applying to medicine is different to applying to other subject strands, in that often when you apply to medicine, it's almost like you're applying for a job. And so when you think about what qualities are good for applying for medicine, you need to consider what qualities are important for being a doctor. And now obviously things like communication skills, empathy, teamworking and leadership are really important. But there's so many other characteristics that you need to be a good doctor, and it's not that you need all of them to apply to university. It's that you've got to have a good appreciation for what's important and be able to show that you're trying to improve that yourself.